to be Yorkshire.
Jonny I'Anson.
BBC Radio Leeds.
So it looks like good news today. There are signs that the rise in the number of children in England who are overweight may be starting to level off. A study published in the online journal Archives of Disease in Childhood shows the rates of increase in childhood obesity has slowed dramatically in the 10 years up to 2013. Cornelia van Jaarsveld from the King's College London is behind the report.
Maybe we have reached the ceiling effect, because we would never expect 100% of the children to become overweight or obese. And at some point, we have reached a ceiling. On the other hand, there are obviously some programs and prevention initiatives, and a lot has been done, is already being done.
Well, Eustace D'Souza is from Public Health England and has welcomed the development, but said that there are still problems that must be tackled.
We also know that as children get older, and particularly as they start becoming more independent, they choose what they want to eat, that those rates start increasing quite significantly. The proliferation of fast food opportunities for children on the way home from school, the relative cheapness of some of that food is probably creating what we would call an obesogenic environment, an environment where it makes it hard.
Well, joining us this afternoon is Kiara Lewis. She's the head of the Division of Health and Wellbeing at the University of Huddersfield and joins us now. Afternoon to you, Kiara.
Afternoon.
Are you pleasantly surprised, or is this almost in a way bad news that we can't get any fatter, or our children can't get any fatter? We've reached peak fat, as it's been referred to.
I think it is good news that the BMI figures, it does suggest that there is a levelling off. Unfortunately, what the BMI figures don't tell us is the levels of childhood obesity. It only tells us the children's height and weight. And there's other research out there that suggests that although the BMI is levelling off, children's waist circumferences are still increasing at the same rate.
So BMI being body mass index.
Yeah.
Just explain the importance and relevance of that.
We use that universally as a measure of obesity because it's quick and easy. We just measure your height, we measure your weight, and then we can calculate your BMI, and from that we decide whether you're obese or not. But it's not actually measuring levels of body fat, and it's not measuring where the body fat is, and it's actually the fat that's around the abdominal that causes more of the health problems, and that's more concerning than the child's actual height and weight.
So what do you think then, Kiara? I mean, is the message getting through, or is it the fact that, unfortunately we've got to this point where so many children are fat, they just can't get any fatter, as we heard before?
I think it's right. We have got this obesogenic environment, and so it is more and more difficult. And what the BMI figures show is that the levelling off is only in the more well-off parts of the country, and in the deprived areas, the rate is rising at just the same rate. So really, it's more of a problem in deprived communities, and so the problem isn't going away.
There's also an issue in older children. The research adds that obesity amongst 11 to 15-year-olds is still rising.
Yeah, and particularly in girls as well. So I think there are lots of different factors. There are some successful programmes that are working. There's a scheme in Kirklees that is working well with pockets of individual children. But as a country, there are still so many issues that impact on this that we're not able to control them all.
Why is it that there has been such an escalation in the number of children who are reaching dangerous levels of obesity? The number of obese people in the UK has more than trebled in 25 years across the board. Is it the fact that we are just not teaching our children to eat properly?
No, I don't think you can put it down to one factor. I think this obesogenic environment that we live in makes it so easy to eat, and to eat food that contains lots of calories, and there's no incentive to exercise. So there's more and more cases of children being very sedentary. They're not moving about at all, and it's that combination of easy access to calorie-dense food and lack of opportunity to be active, and lack of incentive to be active. So, all the game consoles and just being able to sit down and not having to go anywhere.
How do you fight against that, though, Kiara? Because computers, iPads, tablets, all that kind of stuff, sitting down and playing online games for 4 hours has become part of a culture now, hasn't it? It's not just part of childhood, it's part of a culture. And when that is so ingrained, how do you challenge that?
Partly we try and challenge society norms. So, should you be getting in the car and going in the lift, or should you be walking the stairs and walking around more? And should we be sat at our desks 8 hours a day, or should we be getting up and walking around? It's sort of that filters down to children in that if they see the parents sitting down all the time, that's what they do. And so as a society, we've got to recognise that being active is the normal way of being, and sitting down all day isn't going to help any of us.
The difficulty is, as you say, there are so many factors to it, and life has changed so much in comparison to what it used to be. We'll have people sat at home now saying, well, I just used to go out and climb trees, play war, chase, tag and all that kind of stuff. But it's not the same anymore. There are fears over how safe children are when they're out. There's the pressure of modern life and parents being stressed and having so much to do. They just want their kids to sit quietly and play on a computer to give them 10 minutes rest. Like you say, we've got calorie-dense foods left, right and centre. It's such a complex issue that I don't know if we can get out of this.
I think it's something that has to be tackled at all levels. So it's an issue for health professionals, but then it's an issue for social workers, it's an issue for government, it's an issue for schools. And it's until everybody recognises that it's their responsibility and everybody has an input and starts to work towards it. It won't be till everybody plays a part that we can see this making an impact.
OK. Kiara, thank you very much for your time this afternoon.
Thank you.
That's Kiara Lewis there, Head of Division of Health and Wellbeing at the University of Huddersfield.
The University of Huddersfield, inspiring tomorrow's professionals.